This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour. Our focus again today is your amazing human brain and the millions of people who suffer, very deeply suffer, each time they get a migraine. So exactly what is a migraine? How is it different from a headache? And let's learn about what you can do, some non-pharmaceutical solutions to help you prevent migraines. So we're going to do all of this with our guest. He is Pharmacist Gregg Russell, founder of Fort Wayne Custom RX, a compounding pharmacy right here in Fort Wayne. You'll find them just on East DuPont Road, right behind the Casa Grill. Gregg, great to have you back again. I love talking with you. Your dual role as both a pharmacist and a clinical nutritionist helps a lot for people who are looking for alternative solutions. So that's one of the things we'll talk about in a moment. But first, let's focus on just what is a migraine for people who, we all know it's kind of a headache, but it's not really just a headache.
No, it's not. And, unfortunately, there's a lot of migraine sufferers, right, across the world. And, I personally have had family members that have them. They are basically a brain that becomes inflamed and goes kind of out of whack. And, our brain chemistry is a fine balancing tool of flowing of chemicals and brain chemicals and blood flow into the brain. And when things go wrong, there's this initial, it's almost kind of like you're going into shock. There's this initial excess flow of blood into the brain, and it triggers off this chain reaction that's very, very complex. And early on, we used to treat these type of headaches with certain drugs that kind of cause constriction of different vessels of the brain. And, some of those old-fashioned medications would work for some and then didn't work so well for others. And unfortunately, there's so many migraine sufferers, and it seems to affect 3 times as many women as men. So unfortunately, ladies are at higher risk, and there's lots of different theories on why some of that is. Part of it's probably because of estrogen's role in the brain and the fluctuating hormone levels during menopause or before menopause. So it's a very complex system, and serotonin, norepinephrine, some of the old-fashioned neurotransmitters are involved, and there's some new ones too, some different peptides now that have been investigated, and that's kind of where modern pharmacy is going to today.
Lots of new drugs. There was a nasal spray that was just approved earlier this year, and in the past couple of years, there have been several new medications. And you were telling me earlier, Gregg, they are so expensive, and some of them are not well tolerated. Tell me more about that.
Yeah, unfortunately, these new drugs called the calcium gene-related peptide antagonists, or we call them CGRP, quite long name product class of drugs, but they work on a peptide that's involved in that inflammatory response, and they block that peptide's. They address it by blocking that peptide. And so what these chemicals do is they are biological agents. They're monoclonal antibodies, so they're expensive to make. And of course, every one of the big giant pharmaceutical makers are that work in the brain area of brain chemistry has a product out there. But generally they're pretty good. As helping to prevent headaches. Some of them are being indicated also for a dual role of treatment, which is the new one that just came out, as also a dual role for treatment and prevention. You have to be careful if you have a hypertension, for example, with some of them. But probably their biggest thing is some of them have to be injected. Some of them you have to go to a doctor's office to get an infusion. They're typically used. There are some oral ones, but they are pretty expensive. They range anywhere from approximately $1,000 to $3,000 a month.
Wow! Yeah,
so for those guys that are self-pay, that hurts.
Tell me, what do you see? What do the patients you treated? What do they have in common? What do migraine sufferers kind of follow a path?
Yeah, I think I always recommend people when they're migraine sufferers, keep a migraine diary. You're looking for different things, different triggers. Certainly caffeine can be a trigger for some people. Certain wines can be a trigger. And then our good old friend that you and I have talked about over and over again is sugar. Sugar seems to play a role, and some people, they just really dramatically reduce their sugar consumption. That can certainly be helpful. But we also know that some of our minerals play a role into that too, like magnesium. We know migraine sufferers tend to have lower magnesium levels. And so not that that's necessarily the cause, but that certainly is an association. And so that would be one thing that we would look at, is trying to make sure people have adequate magnesium in their body.
As you work with patients, I know that you've seen a broad range of things come and go over the years. Is it safe to say that today's doctors are focused on the new thing and maybe not so much in tune with what had worked before and might still be effective?
Well, I think that's fair to say. And I think, for example, the pharmaceutical industry moves away from some of the older products. I know some of them have been discontinued. There was a product that was an ergotamine product called Hydrogene that was available. I don't believe that's available anymore. We can compound that on a prescription. There was an old product called Migraine that had 3 ingredients in it. One would be in Tylenol, which of course helps with analgesic activity. One being isometheptane, which kind of works like some of the newer products. It causes that vasoconstriction, that spasming vessel, helps control that. One of them was a sedative that's been pulled off the market called dichlorphenazine. Well, we've made that product, compounded those products with the 2 ingredients without the dichlorphenazine, or we've added something like hydroxyzine, which also kind of helps people relax and rest. So that product's available to be compounded. So if the patients that had success with Migraine, but now it's not available, that might be an option for them. We've had headache clinics send us prescriptions, for example. There's a big one out of Michigan one and a big one out of Chicago that we see prescriptions from.
So the bottom line is, no matter where you live, there's a compounding pharmacy probably in your area, and it's worth having a conversation with that pharmacist, because you may know things that doctors aren't that aware of or have forgotten, right?
Yeah, that's exactly right. So, we do have access to, USP-approved chemicals, and of course can compound them if the products are still approved by the FDA. And, we can help patients find things that they used to use but just aren't available. So not in every circumstances, but it's amazing with a little imagination we can get that done. So there's other things that we've done. I like a promethazine wrist gel we've made. A lot of migraine sufferers to have nausea, and some of the medications can cause nausea. So to kind of counter that, we make it used to be promethazine was available as a tablet, but of course if you're nauseous or throwing up, vomiting, you're not going to keep a tablet down. So right. The alternative was a suppository. Well, people don't love suppositories necessarily, so this is it's a nice gel. We just rub it on the wrist, and that kind of helps some of the migraine and adverse effect of being a migraine sufferer.
So let me get that straight. It's just a gel that I apply that keeps the nausea in check?
Yeah, it's promethazine. It's a drug that's been used for nausea. It's available in hospitals, for example, as an injectable. Certain patients shouldn't use it, but shouldn't be used in children, for example. But it can be used to help people that tend to, and I've also had doctors write it for patients that get car sickness. They get in the car and they have to drive. They get car sickness. So it's a nice product for that.
Okay, prescription only though.
Prescription only. Yep.
Got it. Now there are over-the-counter products that are designed to help prevent migraine. So let's spend a little time talking about those. And one of them that I know you have had custom compounded for you is called Migraine Clear. What's unique about this one?
Yeah, we've had this product manufactured for us, and it's kind of a play off another product that was around, or is still around. You can see it. It's a combination of magnesium and riboflavin, but it has some other herbs in it that I like. So we'll start with magnesium and riboflavin. So, like I said earlier, magnesium has been shown to be lower levels in patients that suffer migraines. A drug there is a study that shows that a drug, when used in combination with magnesium, it's called valproic acid, which is also used to help prevent headaches. They were able to actually lower the dose of the valproic acid when it was used in combination with magnesium, and it was more effective. It helped reduce the headaches. So we know that magnesium has a role in that transmission of those brain chemicals in the brain. And we also know that they've done samples where they've migraine sufferers versus people that didn't have migraines, and that they were considerably lower in magnesium. So we do know that, especially for spasming headaches, magnesium seems to have a role. And so we've had doctors also that give magnesium in their office as an IV infusion to help with a migraine attack, especially like cluster headaches, which is a very severe form of a migraine headache.
Okay, so this Migraine Clear has magnesium in it, so that's a mineral, but there are also some herbs included, and one of them I've never heard of before, butterbur. Tell me what that is and how it has an effect.
Yeah, butterbur is real interesting. It seems to also work on these constriction of these vessels. It's back years ago, butterbur was one of those few herbs that actually the FDA said, hey, this shows, and the medical associations said, hey, butterbur is effective. And so it's kind of nice because a lot of products don't have butterbur in them. And one of the reasons it's kind of fallen a little bit out of favor in mainstream medicine is because there is cross-contamination. There are different chemicals in butterbur that are actually toxic to the liver. So making sure that you get a great quality butterbur product is essential. And so that's, the product we brought in is a real clean product for that reason. And so, because we don't want people to have liver issues, obviously. So
Obviously,
have to be careful. And we do recommend that, people do get their liver enzymes checked on a yearly basis, maybe every 6 months the first year, just to make sure something's not going on that they don't know. But there is also some people are ragweed sufferers. There is some cross allergy issues with butterbur. So we have to be careful with those type of patients too. But it does seem to help lower inflammation. It stops that constriction process, part of that chain reaction. So I like that. Riboflavin has been used also. That's a B2 vitamin. Now this one is not your 25, 50 milligrams that you see over the counter. It's usually around 400 milligrams a day that people need. The thought is that it's involved in those energy pathways in the brain, or the mitochondria as they work in the brain. And so, again, we don't really know why it works, but it does seem to work. And these products have about 40% of patients will say they get some kind of relief with these products.
Wow.
So
40%.
that's pretty high, really.
Those are pretty good odds. Feverfew is another herb that is in this compound. Tell me, what's its role?
Yeah, it seems to decrease serotonin. So there are certain the trypsin type drugs worked on serotonin in the brain, and so this is kind of mimicking serotonin's effect, and we know that that's involved in this. It also works again on those prostaglandins, and again another set of brain chemicals that works. Small studies show some benefit, but we do need some larger studies. So we throw it in there. It seems to help. And then we have some other herbs that we use like ginkgo and ginger root. Ginger root kind of, we know it helps with nausea. So we kind of like that. It also has anti-inflammatory pain-reducing effects. And ginkgo is another drug that seems to help with brain circulation of the brain. Got to be cautious for people on blood thinners, of course, with that one. So I love this product. It's usually dosed 2 capsules twice a day.
And the goal here is preventative, right?
Try
So
to
I
prevent it
take this on an ongoing basis.
Yeah, I would probably try it for 2 to 3 months, see if that's making a difference. If it's not, then, it doesn't work for everybody, like I said.
So, and does this reduce the frequency or severity? Where's its target really?
It does both. So it seems to do both. And again, I think, we talk about this neuronal balance, these chemicals. If you can kind of stabilize the brain and kind of calm it down, is the way I kind of look at it. If the brain gets kind of calmed down, then you have less chance of a major issue when you do get one, or hopefully the frequency declines too. So that's kind of the goal.
So I have seen over-the-counter products that are specifically like Excedrin migraine formulations, and the supermarkets all have some kind of a migraine compound. What typically are those, and what's the risk?
Sure. So they primarily contain our good old friends, the non-steroidal anti-inflammatory drugs, which I'm not a real huge fan of because long-term use. We know that overuse of these products actually can cause what we call rebound headaches. So, that's one of the wonderful things that's an advantage and a disadvantage in a modern society is you can walk in anywhere and get these products, but you can also overuse these products. Many of them contain caffeine. So, like I said, some people caffeine's real helpful, and other people caffeine seems to trigger. So it's a mixed bag. They can be helpful, but long-term use, you don't want to use those products long-term.
So if I'm a migraine sufferer, the studies I have seen say that not all migraine sufferers go to the doctor. Many people just suffer in silence.
That's probably the saddest thing is that a lot of people do suffer in silence. Roughly about a third of the people that have migraine sufferers don't go to the doctor. And so it's been estimated. So they just suffer in silence, and that's the sad thing is because the interesting thing is whether you're using a preventative nutritional product to try to help or even a prescription drug, they are effective, and they're not effective for everybody. And sometimes you have to switch drugs around to see what works for you. And of course, your doctor has to look at your medical condition. For example, I would not give a ergotamine type medication to somebody who has hypertension, especially uncontrolled hypertension. The ergotamines themselves, because they constrict those vessels, overuse of them can cause rebound headaches, but they also can cause poor circulation issues, and of course, in the most severe cases, can even cause gangrene. So, these drugs have to be prescribed by a family physician or even maybe a neurologist that knows what to look for on this.
But I want to get to the role that a compounding pharmacist and somebody who's trained in nutraceuticals like you, if I'm just not getting a response, the medications aren't working for me, or maybe I just feel as though I'm not in sync with my doctor, what's the role that a pharmacist can play in this combination of care?
Well, any pharmacist should be able to look through patients' medications. That's the first thing we would recommend you do. We look at your medications. Is there a specific medication that might be causing the migraine headaches, especially if you've started something new? And then that's usually, sometimes that's obvious and sometimes it's not so obvious, but we want to make sure you're taking your prescription medications right. Could be you're just not taking a medication properly, and a side effect could be the headache. So, we just want to make sure that's the other thing I look at being for kind of on the nutrition end of the business, how is your diet? We know that environmental triggers are huge. We know, is your diet clean enough? Are you eating organic? Are you eating non-processed foods? Because we know there's chemicals. I mean, I just saw, those forever chemicals in water. There's an article, I haven't even had a chance to read it yet, but, talking about how prevalent it is with the forever chemicals in our water supply. So are you doing everything you can to try to prevent being exposed to environmental chemicals? How's your liver functioning? Do you need to consider using some nutritional products that are going to help support your liver, i.e. detoxification, but not really detoxification. In fact, we're giving you a laxative. We're trying to just make your elimination organs work better by using herbs and vitamins and a clean diet. So, those are things that we can help patients with. They can certainly, contact our pharmacy and make an appointment, and we're happy to sit down and look at, what we can do to help them, support them.
And then what's your role in interacting with the physicians? Do you actually get on the phone with the doctors? How does that work?
Yeah, usually it just depends on the situation. So, for example, let's say it's a patient and we do an extensive interview, and maybe my nurses interviewed them, and we know it's menopausal, it's cyclical related of some nature. Well, in that case, we may write a recommendation for maybe a compounded hormone product. Of course, there's a lot that's going to go into that. There's going to be a lot of communication between the doctor, because that takes special testing, symptom review, but we've had patients that have been, especially if it's an estrogen-related headache or a progesterone-related headache, shifting in cycles, maybe the goal is to kind of help level out that cycle fluctuation so that they're not experiencing these extremes, and that might be helpful. So that would be one example where we would get on the phone. Another example might be, we recognize there's some kind of a drug interaction going on. Then we might, intercede for the patient in that case. So, it just really depends on the circumstances. But we always write reports, and we're happy to share any of our reports with any of our physicians.
And I think that's one of the key messages I hope that we would get through today is that a pharmacist, a compounding pharmacist, nutritionist like yourself, can be a very important aid to your whole total health package. And I don't think people, we're so accustomed to these big box pharmacists these days, and, they're stuck behind the glass, and they're not very accessible.
They're not accessible. They're very educated, very intelligent people, and I say that in a category. Unfortunately, they're very underutilized, and I think that's the best way of saying it. They are trying to do the job, the service of getting the patient their medication on time, and there are many, many hurdles they have to hurdle over to get the patient the medication, whether it's the insurance company putting up a high bar that impedes. Like I said, some of these medications are expensive. They may pay for drug A but not drug B, but the patient doesn't do well on drug B, or drug A, and so you got to go through the insurance companies, get these things covered. There's just a lot of things, and it's a difficult arena right now to navigate.
Yeah,
but that's why we do what we do.
And that's the point I wanted to bring out is that, we pharmacists are underutilized today, and that's really to the detriment of the patient. So if you have a compounding pharmacist in your community, it's a good idea to get in touch and have that conversation, establish that relationship. Greg, I think we're going to leave it there. Thank you so much. I appreciate it.
Thank you.